So we are going to go ahead and use our non-fenestrated, and this is the one we're going to start with. Now remember, the outside of everything here, it's not sterile, but the inside is. What we need this for is to put on our mayo stand. Your mayo stand will always have a tidy towel. You can go ahead and leave that there, but this is not sterile. So we cannot drop our sterile instruments onto this. We need the inside of this to be sterile to drop all of our sterile instruments. So what we're going to do is we're going to carefully open this up. And we're going to grab it just from the outside. The moment I touch the outside, that's no longer going to be sterile. So that's what I want on the bottom of this, because we don't need the outside bottom to be sterile. What I'm going to go ahead and do is flip it so I can grab a corner. And I want to be really careful. I'm going to grab this side, and then I'm going to grab the other corner. So the corners are not sterile. I'm going to place just the corners, and now I'm going to tuck in the corners into the mayo stand. So what I'm going to do is lift the stand. I can touch this even though it's the outside because it's going to go underneath. And do the same thing here. Lift and tuck. Now that I have it underneath, I can just tuck it. And you can either leave it untucked. I prefer it tucked. And the doctor does too. But in the beginning, you might be a little bit hesitant to do so, and that's fine.
Does it have a sticky bottom?
Once that's done, I cannot touch anything on the top right here. I can touch the sides, but I cannot touch anything that's on the actual tray. So now I'm gonna go ahead and start dropping everything. I like to start with the blade. I'm gonna open it up and be really careful and let it drop. Then you're gonna go ahead and open this up. And your fenestrated drape. As you go, make sure you get rid of your cap. You guys see the only thing I did not drop were my gloves because those I need, and the hyperheater sheet. So this sheet is a cover for this hyperheater. Normally what we use is a small sheet, okay? This one right here does not have to be sterile when we're doing biopsies, but the whole hypercator, including some of the cable, needs to be sterile if we're placing it onto this tray. There's a couple ways of doing this, putting it on here. I'm gonna show you guys how to do it without being sterile. I find it easier to do it this way, but I'm also gonna show you guys when you drop it, if it needs to be sterile, okay? So what you're gonna do is make sure that your hypercator doesn't have that unsterile sheet. And then you're gonna go ahead and open this. Once you open it up, the cardboard part at the very top, it's not gonna touch the tray, so it doesn't have to be sterile. So I'm gonna grab it from there. And then I like to do this when I have enough space. So I like to move this out. And I'm gonna go ahead and lift this up and let the sheet drop. When I touch this, it's not sterile, but I can see that it's gonna give me an entry point for the hybricator. So I can touch this because I'm not sterile, and I can go ahead and place it on there. And you just want to make sure that the cable does not touch as you're placing it in. This is why you don't want to have anything around it, because as you shake it, you don't want it to touch.
When you're wearing the sterile gloves, because you said one of them is to set up, can you touch the items with those?
Yes, but you cannot touch this.
Oh, so you use those after?
Mm-hmm.
Okay.
So I'm going to show you, so this is how you would do it non-sterile. So since my gloves are not sterile gloves, I'm contaminated. So I can touch this because this is contaminated. However, I cannot touch the actual plastic because this is sterile. So that's why I don't want to touch it. I'm just touching this. Now that I go ahead and place it, I'm going to go ahead and rip off the cardboard. Bring my tray. And again, this area is not going to touch anything, so I can let it rest there. It's easier than it looks. At this point, I want to go ahead and finish setting up my sterile tray, so I'm going to remove my gloves. And I'm going to go ahead and put my sterile gloves on. The outside I can touch. It's sterile, but it doesn't need to be sterile for me to put on my gloves. If you have any rings, bracelets, I recommend you remove them before your surgery. Makes your glove application easier. I'm already going to open up the gloves that the doctor is going to use. And I'm going to prep them for her by just leaving them open like this. Again, this was sterile. It's no longer sterile because I'm touching it. But the inside and the gloves are still sterile. So I'm going to leave them here for the doctor. And I'm going to open some up for myself when I'm going to assist her in surgery. Now, to properly, we have a video on how to properly put your sterile gloves. I'm going to go ahead and open them up. I'm going to use the corners. You can see right and left. Again, the outside we don't need it to be sterile because the gloves are inside. So I'm going to open this up this way. Lift up this top and open it up. I like to start with my dominant hand. So where the fingers are, that's the outside of the glove. So that needs to remain sterile. My hands are non-sterile. The only thing I can touch is the inside of the glove because that's going to be touching my hands. So you start with your dominant hand. If you're a left-hander, you start with your left. I can touch the whole inside and I can touch all of these because it's going to go inside. So I'm going to go ahead and open it up. And again, I can touch all of these. Put my in. And then here, just tuck it like that. Okay? I can adjust this at a later time. So now, this hand's sterile. This hand is non-sterile. This hand can touch this and the inside of the glove. This hand can touch these. Because these are sterile, my hand's sterile. So what I'm doing is I'm going to go ahead and grab it from the thumb and start lifting. At this point, this sterile hand can't touch this because my hand has not touched that area. So I can go ahead and lift it to separate it. I'm gonna tuck in my hand in here. And then with my dirty hand, I'm gonna grab this. Start separating in here. Out. Let go. And now with my sterile hand, my hands are sterile. I can't touch this anymore. Okay, so the only thing I can touch is here. If by accident I open the door for someone, I grab this to try to throw it away, something falls and I pick it up, I scratch my nose, fix my hair, I need to re-glove. Okay, so now that I'm sterile, I'm gonna go ahead and grab this and start setting it up. I'm gonna start pushing everything to the side. To find your blade, that's the first thing you want to go ahead and take care of. You're going to grab your scalpel and your needle holder. Needle holder works by, there's this little clasp in here. So you can clasp it like this, you can make it tighter. To let it go, you just press. Let's go. So I'm going to go ahead and grab my blade. This is the 15 blade. This is going to be the sharp side. I'm going to go ahead and grab it from here, which is right. This is where the scalpel is going to secure the blade with. I'm going to go ahead and grab it from here and I'm going to lock it onto the first clasp. I'm going to grab my scalpel. My scalpel has, as you can see on this side, it's flat. And then on this side, it's raised. This is what I want inside my blade. Okay. So I wouldn't put my scalpel this way on the flat side because there's nothing for the blade to grasp onto. As to on this side, I can go ahead and get a grasp. The scalpel is gonna have like a little, I don't know if you guys can see, and you guys like can get really close and see it. There's like a little hole in the middle. That's where the blade is gonna go ahead and go in. Okay? So the way you place it is you're gonna make sure you know where the line is and you can feel it. So when you're doing it, you feel when you're in the right place. If you have to struggle to put it in, you're not in the right place. So like this, I'm struggling, so I know I'm not in the right place. I feel it, so I'm gonna go ahead and push it in. Once you hear the sound, you know it's locked. I'm gonna try to push it out a couple times. It's not working. That means it's in its right place. I'm gonna remove the clasp. My blade secure. Just to be sure, I'll grab it unsecured and just move it out a little bit. It's secure. I'm gonna put that to the side because you don't want to cut yourself. And then I'll do all my scissors and put it to the side. I'm gonna go ahead and put gauze right here, the other gauze right here. I'm gonna go ahead and move the hybricator now. I can touch it because I'm sterile. I just can't touch the last part. I'm gonna place it like this. This is gonna make sure the hybricator doesn't move around. This is trash. And I'm gonna also unwrap the cotton socks. I'll place these here. This is trash, so all I'm gonna do is grab it and drop it right there. My instruments will go here. So this is the needle holder that the doctor will use for the sutures, which I'm gonna leave here. These are the scissors that you use to cut your sutures. These are the scissors. The ones that have a curve are the ones that the doctor uses. Okay? Your scalpel and the pickups. Doctors, yours. This is what you're also going to use to stop the bleeding. So what you use, what the doctor uses. The sutures, you need to open them up. So these open like this. They have an arrow right there. Lift them up. This is trash. These right here, the only thing you need to do is just leave them alone. they have the needle right there, so the doctor can easily grab it and start using it. She starts with the blue ones go on the outer layer, the superficial. So she always starts with the purple ones, which are the subdermal. So you grab the needle, and you're just gonna go ahead and grab it and lock with your needle holder. Needle always facing down. This makes the doctor's job easier because then that way she can just pull and she can start doing her sutures. The last thing you're gonna need is your hybricator, the cover. You're gonna remove it. And we were testing the plastic wouldn't melt in the autoclave, which it did. So this is trash. I'm gonna have one of you grab this sterile hybricator that's right there.
This one?
Yes, please. And then I'm sterile, so I cannot touch it. So there's gonna be a little tab right here on the front, like separate the paper from the plastic. Perfect. And if you just slowly open it and just drop it here without touching the actual hybricator.
Oh, it's struggling.
It's a little bit touchy. The key is to do it slower, just so you don't have it flying. You're fine. Take your time. The slower you do it, the better, because you know perfect. There you go. So now you can just flip it. Thank you. Okay. So now you're gonna go ahead and remove the plastic trash. I don't need it. This is sharp, so don't grab it. And then you're gonna go ahead and place it. So the way you place it is also important. You see that the buttons are here. So you wouldn't want to place it this way, because the doctor grabs the hybricator like this. So the blade needs to be facing down. Grab it. Place it down like this. That way when she grabs it, she can use it correctly. So we're gonna go ahead and leave it there. This is the fenestrated drape, so I'll show you guys what it looks like. This one has a fenestration. So what Dr. Kormeili does is she'll go ahead and place this over the area that we're going to perform the surgery. The site will go in here. So this one, we want to just leave closed. You don't need to open it. And we want to make sure we cover this so it remains sterile, nothing falls on top of it. So we're going to use this drape. I can touch it all because it is all sterile. And I'm going to use it to cover it. I'm done with my tray. I can touch this still being sterile. So I'm going to grab my tray and move it closer to the chin. So if the patient's going to sit like this. If the patient had a lesion on their right thigh, the tray, instead of being on this side, should be on this side. If it's on the left, on this side. If it's on the left back, most likely the patient will be like this. So the tray's on this side. If it was on the right, so that's why also the location is important, so you know when to put the tray. When you're done putting your tray, you can remove your gloves. And now you can throw it. And you're ready